Health is holding an expo later this month to help the community learn a number of important skills, including hands-only CPR. Today, I'm joined by Chest Pain Center Program Manager Greg Breslin to take us through. Great to have you here. Happy New Year.
Happy New Year. Thank you for having me.
Why is it so important to learn hands-only CPR?
Well, hands-only CPR allows the community to be able to help us manage patient care better. You know, cardiac arrest is one of the #1 killers in the United States. Almost 80% of patients who suffer a cardiac arrest in home or at a store or anywhere else don't make it to survive after they've gone through the hospital. So what we have found is that providing CPR early on in a process and getting EMS activated early allows for a greater chance of survival, up to 60% in most cases.
And no mouth-to-mouth needed, hence the name hands-only CPR. That's a newer recommendation in recent years,
It is, the last couple of years, and it wasn't brought on by COVID. It was something that was actually done with a lot of research to show that we can still provide adequate compressions and oxygenation to the brain to allow for survival, because what we're really doing with CPR is actually saving the brain, not really protecting the heart. So that's what our goal is.
And you brought a friend next to you here because this is
George.
This is George, and this is the demo that you would use during those CPR classes. And I know you guys have had these like workshops like all over the city, like during half times at games and things. It's just that easy to learn in such a short period of time on George.
That's right. I teach kids at school, high school, elementary school, community centers, things like that, and it takes a minute and a half. It really does.
Well, that's not the only workshop and kind of class that you're offering in the new year. You have a number of other screenings as well. You want to begin with Stop the Bleed? Stop
the Bleed is a great process, one that we're really educating a lot of kids on, especially right now. But learning how to take care of a trauma-based issue is really important at home. Again, medical care is hard to get sometimes, and for a lot of people who have to rely on themselves, it's important to kind of learn some of these skill sets. So understanding how to manage a bleed at home if somebody gets hurt, to call 911, and then also doing blood pressure screenings. We're going to have cancer, and with the Kentucky Cancer Society, I was going to be there as well. So we're going to try to make it a full gamut of processes to help you understand better health for yourself, as well as learn some great skills. All
of these classes, skills, screening, everything will be available at a health expo happening later this month. Where is that going to be, or any details you can tell us about?
That's going to be at Jefferson Mall on January 9th.
Very nice, very nice. And so it's free, right?
It's absolutely free.
Which is the best thing. I think sometimes we think, well, you know, this is not going to be covered or this is not going to be covered. Show up and get all these screenings done right then and there.
Absolutely.
On the cancer side, you mentioned a couple of them, because that is so important, because that sometimes can kind of lurk in your body silently and you don't know that something like that is going on. And one of those screenings will be skin cancer screenings too, because we often can think we have a mole or a sunspot and it's something else. I've bared witness to that, where I'm thinking, that's just a mole. And they're like, no, Claudia, that's skin cancer.
Well, people don't pay attention to that very often, and they won't go to a dermatologist without having some kind of need to go. So this is a great opportunity to find out if I really need to make sure I make an appointment and follow up on something that maybe kind of showed up unexpectedly.
Anything else we need to know ahead of that? Or if we can't make the expo, can we just contact you guys?
Absolutely. We'll have something on our website as well that you can go to. We also will be able to provide you some access to content and more instruction if you want to come and set something up after you come, as well as physician scheduling for doctors.
Sounds good. Good to see you. Good to see George. You're going to have a busy new year, I know. For more information on the health fair and for all of the events that they have coming up, and schedule your screening, maybe if you can't make it, just head to UofLhealth.org.